Number 10 is to get therapy early. So a lot of people get therapy, physical therapy, occupational therapy, speech therapy after a doctor orders it, maybe after an injury or an accident and something happens and they get therapy to get them back to where they were. But you can ask for therapy as well. We don't have to wait for something to happen to go and get those services. That's just often how things are done. So, like I said, you don't have to wait for it to be recommended. You can ask for it and just work on strengthening those skills before something bad happens. Maybe you're right now feeling a little off on your balance, or daily activities like getting dressed or getting in and out of the shower harder than they used to be. These are things that we can work on with therapy, and we don't have to wait for something to happen to get those services. We can strengthen those skills now. So a lot of people I've seen don't really exactly know what each of these therapy disciplines do. So I'm just going to run through those really quickly for you. This is a picture of my team a year ago. And so there's me, a speech therapist, and a PT assistant. And so physical therapy is usually the most well-known, and they work on things like your balance, your strength, walking and gait pattern, maybe helping with using a walker or a cane and finding out what's best in terms of that. They help with pain reduction a lot of times, knees, hips, feet, all of that stuff, and just general strengthening as well. So that's physical therapy. Occupational therapy, which is what I do, we work on just helping you do what you want and need to do. So it's more function based. So maybe a physical therapist helps you walk, and an occupational therapist will help you walk into the bathroom and do what you need to do there. That's kind of how I explain the similarities and differences between the two of those. But we help with all of our daily functions. So getting dressed, going to the bathroom, taking a shower, cooking our meals, feeding our pets, like I said, anything that we want and need to do throughout the day, managing our medication. We sometimes work on cognition and helping support people in that way. So if we're thinking function and what we're doing, it's not occupation as in job, but occupation is in our daily occupations, which is just, like I said, what we want and need to do. So we overlap in some ways. We can work on balancing and strengthening. We do more upper extremity, while PT kind of does both upper and lower. So those are just some things to think about. And then speech therapy is not just speech. OT and speech, kind of the names, it's hard to understand exactly what we do. So they work a lot with cognition also, and they do voice and projection for people who have a hard time speaking, and swallowing. So if someone's having a difficult time swallowing what they need, or maybe aspirating, it's going down the wrong way, they help with techniques to support that. So I just wanted to kind of share that. So if you recognize yourself or someone having difficulty in any of those areas, that's when we can reach out to therapy. So if you're thinking, yeah, maybe I should get some therapy before, things progress, you can either reach out to your doctor and ask them for a referral. You can reach out to therapy and they can kind of direct you where to go in that way. So number 10 is to get therapy early, not wait for it to happen to you.